The urine dipstick is a readily available and inexpensive method for the initial detection of various substances in a patient's urine, including protein. The presence of protein in the urine, a condition known as proteinuria, can be an important indicator of underlying kidney disease or other systemic issues in our canine and feline companions. In routine clinical practice, the urine dipstick is often the first step in identifying potential proteinuria. These dipsticks utilize colorimetric reagent pads that provide a rapid, semi-quantitative assessment of the protein present, primarily detecting albumin. Albumin is a major protein in the blood, and its presence in significant amounts in the urine suggests that the filtering units of the kidneys, called glomeruli, may not be functioning properly. Despite the convenience and low cost of urine dipsticks, their utility in accurately quantifying the amount of protein in the urine is limited. One of the primary reasons for this limitation is the influence of urine-specific gravity, often abbreviated as USG. Urine-specific gravity is a measure of the concentration of solutes in the urine, essentially indicating how dilute or concentrated the urine sample is. A highly concentrated urine sample can make even a small amount of protein appear more significant on a dipstick, potentially leading to a false positive result. Conversely, in very dilute urine, a clinically relevant amount of protein might be underestimated, leading to a false negative result. Factors such as the patient hydration status and kidney's ability to concentrate urine can significantly affect the urine-specific gravity. To address this challenge and potentially circumvent the need for a more involved test called the urine protein creatinine ratio, or UPCR, some researchers have proposed a calculated value known as the dipstick urine protein to USG ratio, or DUR. The urine protein creatinine ratio is a valuable tool because it has been shown to accurately reflect the total amount of protein lost in the urine over a 24-hour period. It involves measuring both the protein and creatinine concentrations in a single urine sample, and the ratio helps to correct for variations in urine concentration. However, performing UPCR can sometimes involve additional time, cost, and the potential need to collect further urine samples, which can be inconvenient for both the pet owner and the veterinary team. The concept behind the dipstick urine protein to USG ratio is to take into account the urine concentration when interpreting the dipstick result. This study provides valuable insights into the utility of the dipstick urine protein to urine-specific gravity ratio in veterinary patients. The findings suggest that the DUR can be a relatively reliable method for identifying dogs and cats with clinically relevant proteinuria due to its high positive predictive value. A positive DUR result should prompt further investigation with a urine protein creatinine ratio to quantify the degree of proteinuria.